December is World AIDS, HIV, and AIDS Awareness Month. But I suspect that our discussion is not going to center just around that, because the immune system is so important and has an impact on every single disease, every level of discomfort that we may or may be experiencing can really be linked to the immune system in some way. So I'm looking forward to hearing what Dr. Prasad has to say on this subject. So let's get ourselves started. My name is Jonathan Jones, for the record, and today is December the 7th, 2025. It's a few minutes after 5 p.m. Eastern Standard Time. We have this discussion every Sunday, 5 o'clock Eastern Standard Time. And our goal is to help you to understand or to see that there are tangible things that you and I, average people, can do to improve our health and our well-being. The importance of the immune system came clearly into focus for me when my mother was in intensive care, and the immune system, the intensive care nurse said to me, when I asked her what was she doing for my mom, my mother had renal failure, so she was on dialysis, and she had a clot, so pulmonary embolism. So she had been in intensive care just a few days before. And amazingly, this medical center released my mother from intensive care directly to home once they felt that she was okay. And normally they step it down so they have a chance to monitor the person to make sure that they're stable. But they sent my mom home. The next phone call I get was my brother had called 911. The ambulance picked her up and took her to another hospital. And my sister in the middle of the night called me up and said that they're talking to her about, what about signing a DNR? I said, DNR? I got up and ran to the hospital, flew there as quick as I could. So throughout the night, I'm seeing nothing happen. So I asked the intensive care nurse, what are you guys doing for my mom? She said, well, we're monitoring her very closely. I said, well, I'm doing that. I mean, what are you doing to make her better? And her words were, and I quote, to be honest with you, Jonathan, we're praying for her immune system to kick in. Now, that screamed to me the vital importance of the immune system. And they didn't have anything to kick her immune system in. So I was just baffled by that. My mother did not have AIDS or anything like that. But again, we're talking about the immune system here. That's when it became critically, just infinitely important to me, just how valuable the immune system is. My mother had diabetes and complications of it, and that's what they wanted, was her immune system to kick in. So that's changed my focus. It completely changed my focus and made me lock in to a much greater degree on the immune system. And because I was determined I'd never be in a situation again where I did not have something in my possession that would so-called kick the immune system in. And sure enough, there are a lot of things out there that can do that. And you are privileged here today to hear about it. Because again, we're taking advantage of the fact that this is World AIDS Awareness Month. And so now you get a chance to hear from Professor Prasad about what you and I, average people, can do when it comes to our immune system. But on the subject of AIDS itself, look at the statistics. I did use AI for this. So if you want to blame somebody for it, don't blame me, blame AI, because that's where this information came from. It says there are 39 million people living with HIV. And there are even now in this country 1.2 million living with HIV, 1.3 new infections on a regular basis. And every year, there are 630,000 AIDS-related deaths. And look at the number receiving antiretroviral treatment, drugs, medication. Almost 30 million people that are on antiretroviral drugs. And there's 13% that have HIV that aren't even aware that they have it. So that was mind-boggling to me. I really had no idea the number was still that high, because we hear so much about antiretroviral drugs and
Mm.
folks that I'm directly connected to that were diagnosed with HIV. Let's see, going back 20 years. I think most of us remember the basketball player for the Lakers, Magic, that retired because he tested positive for HIV. And prior to that, everyone strongly believed that it was a death sentence. And so there was very little to no hope for someone who had that dreaded condition. But times have changed, and maybe again we'll hear from Dr. Prasad a little bit about how and why that is the case. But before we bring Dr. Prasad on, we'll give you our disclaimer. And the FDA has not evaluated the statements that we're making. You may hear testimonials today, purely anecdotal. Results are atypical, so that means that what happens to one person may or may not happen to you. We are not making any claims that any of the supplements that we'll be discussing or recommending will treat or cure any disease state. So this presentation is for information and educational purposes only. It is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. And if we do open up for questions later in our discussion, just please keep in mind that Dr. Prasad is not a medical doctor. Dr. Prasad is a scientist. In fact, he was a professor at University of Colorado School of Medicine for some 30 years. But he received his PhD in radiation biology. In fact, he was the first one in the world to reach that level. His products and his formulations have been awarded 10, I think we're up to maybe 12 US patents now in the area of micronutrition. The United States government had awarded him millions of dollars to do research and to develop a formula specifically for the military. And in fact, that's where we are now, is that particular formula is incredible when it comes to the immune system. And so that's what makes us look forward to hearing what Dr. Prasad has to say on the subject. He's forgotten more than most of us know when it comes to health and nutrition. And he is the godfather of micronutrient research. He's been published more than somewhere close to 300 times in peer-reviewed publications. And just this year, he's already published more. He's 91 years old and still publishing peer-review publications. His articles are being published still to this day. And there's some 450 references to Dr. Prasad's work in the official library of published medical documents in the United States Government Library of Medicine. So it is my honor and my privilege to be able to introduce into our discussion now Dr. Kedar Prasad. So Dr. Prasad, we say this often because we have you here on this program, and because we're just so thrilled that you make yourself available to join us in these discussions. So thank you very much, sir.
Yes, Jonathan, I always enjoy every Sunday to be with you and engage family, and whatever I can contribute, I'm always happy to do so.
Thank you. Thank you very much again. And we really can't say that enough. So maybe Dr. Prasad, if you don't mind, could you, I've got a slide here that we don't need you to necessarily break it down, but I got it for illustration purposes for the sake of our audience,
Sure.
For them to be able to kind of have a visual idea of the different components of the immune system. And on the left side, it shows the innate immune system. On the right side, it shows the adaptive immune system. Can you give us some idea as to exactly how the immune system works and why it's so important?
Yeah.
Why would the intensive care nurse say to me that they wanted my mom's immune system to kick in order for her to live?
Yeah, I think those two different function. For example, the function of the innate immune function is to send the cells, killer cells, if there is some infection or any kind of foreign particles are there. So they send this cell, different types of cell, primarily neutrophil and T lymphocyte, to kill the invading agents. So that is one of the major function of innate type of immune system. They have cells that are very competent to killing, directly killing, just engulf it.
That's that one that we see there's and almost directly in the center of the screen. It says natural killer cells.
Yeah, yeah,
Very
they are
powerful.
killer cell of
Hmm.
invading microbes, any kind of microbes. And the function of the adaptive immunity is to send the cell to produce antibody against the invading organism. So that next time, and the function of antibody is to kill it. So next time the same organism comes, they will not survive it because and the antibody, once they are produced, they are stayed there forever. And so
I
that's
see.
one of the major function of the adaptive immunity to cell type, send the cell type which can produce antibody, and by producing antibody, they will kill the cell.
I
But
see. So,
memory, but the cells have a memory. Once they produce type of antibody against particular organism, then they remember forever. So the same microorganism or bacteria or viruses cannot invade again.
I see. I see. So, as an example, then most of us were vaccinated, say for smallpox,
Yeah.
right? So everybody was vaccinated, or measles. So the vaccination exposed us to a small amount of that virus.
Yeah, if the virus have invaded you once, that they have antibody, so second time you can get it.
I see.
Measles or any kind of infection.
So the immune system will be ready for it. So that's the reason why we
Yeah,
have to get
because
vaccines.
they have already produced antibody against that one. So just the cell has to go there and release that particular antibody and kill this organism.
That's good. I read an article once. I think it was related to HIV that said that they would hide inside normal healthy cells, and
Mhm.
it was, as you mentioned, only a killer T cell
Mhm.
that could detect that it was inside that cell.
Yeah, and killer cell also is kills the cancer cell because cancer cell becomes a foreign object.
Hmm.
So adaptive immunity cells to kill cancer cell is the T cells.
I see. So that's the reason why they're coming up with more immunotherapy to
Yeah,
try to cause the adaptive immune system to
right.
fight for you.
Exactly, exactly.
So they didn't have that figured out yet 20 years ago when my mother was needing an immune system kicker in her then.
Now, with respect to, very interesting, with respect to HIV, for example, the virus, how the virus enters the cell, immune cells. They attack immune cells first. And immune cell, there is a CD4 type of immune cells. So what the virus does is attaches on the cell surface of the immune cells and enters into the cell. Then when they enter into the cell, they release RNA because this is RNA virus. And when they release RNA, then inside the cell, they have an enzyme called reverse transcriptase. And RNA becomes DNA by the enzyme reverse transcriptase. And the guy who discovered reverse transcriptase is the got the Nobel Prize because that was very important. That RNA can be converted to DNA by reverse transcriptase. So, and then once become DNA, then they incorporated the host genome, and now permanently they start producing more viruses, more inside the cells.
Oh my. You're
So,
describing you're describing a virus,
yes.
some microbe that can use your body to propagate itself.
Yeah, because body has only place body has a reverse transcriptase is in the inside the cell. So once they enter it, and so some of the recent developed drug, they block the entry of the virus, and then you prevent the disease. But in this case, only as far as the antioxidant is concerned, the only thing published information is that the VitaminESuccinate inhibits the reverse transcriptase. So if you have no reverse transcriptase, virus will die eventually because they can't survive without reverse transcriptase. You can't divide it. Until you become converted to DNA, you can't divide it.
Wow. Wow. That's pretty amazing. And we have vitamin E succinate. And
Oh,
listen, folks, for those of you who are here, it was Dr. Prasad who's given the credit of discovering that vitamin E succinate is cytotoxic to cancer cells. So when he sits here
and many
telling
other
us
functions.
anything about vitamin E succinate, it's because he knows it. He knows a little something about vitamin E succinate. Now you're telling us that that also happens to stop this. Um,
Replication inside the cell, replication of the virus.
oh my goodness!
Because if you don't have a reverse transcription is inhibited, you can make a DNA, and you can make a DNA, you can replicate.
Wow, that's pretty impressive, Dr. Prasad.
Very, I mean, it just occurred to me. I have not thought on this issue on HIV in my recent research study, because it is very interesting that, since 2018 to 2022, there is a 12% decrease in HIV infection in the USA.
Mm,
So, so it is in decline trend. And the data you presented was, of course, worldwide data. In US, even in US, the prevalence is about 1.2 million
right,
total number of people at a given time.
right.
But I mean, and also this infection is in some ethnic group is very high, like in Black population or Hispanic population, they are high.
Mm-hmm.
It could be, resources, financial issue, poor diet, poor things, poor immune function, and then lifestyle. Many factors are there. But in any case, so it is very easy that at least you can treat it better in combination with the current therapy with our micronutrient. And
Wow.
a very important thing about which I did not know until today when I was doing the research after your information, that intestinal dysbiosis, these viruses, once you get into the cell, they generate a lot of free radical inflammation marker, and they increase the severity of intestinal dysbiosis that creates more damaging chemicals. So you can see that how disease starts progressing it.
Yep. Yep. That makes perfect sense. Well, why since you mentioned that, Dr. Prasad, can we talk a little bit more here about free radicals? Because I think some in our audience they hear the statement free radical a lot. And when I was doing the research on this, AI said that free radicals and oxidative stress help the virus, to expand. So could you tell us? We're
No,
looking at this
no,
one
the free
slide here
radical,
about free
the
radicals.
viruses actually produces free radicals.
It produces free radicals. Okay, that's
Yeah,
one of the things.
yeah, and so that means it has a building more damaging environment so that they can replicate. The free radicals is so and free radical is just the what you call ion, which has a negatively charged particles, and and it is very reactive, and from oxygen, it derived from the oxygen. And that then oxygen, once you have oxygen, a species, and then other types of different types of free radicals are formed, like peroxynitrite and all these kind of things. But those are a very complex issue. But the formation of free radical is first by the type of food we eat, environment. They also increase the free radicals formation. But
Hmm.
viruses, when they invade it, they want to do more damage so that they can live happily or grow happily. I mean,
Yep. 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 Understood. Understood. So, this is one of the things that really depletes our immune system. The fact that we have this massive amounts of free radicals, the immune system can be used up fighting these free radicals.
Yeah. And what happens is why it causes immune cells damage? Because when free radicals are produced, first, they try to repair it, damage. But if the repair of the damage, if free radicals are too much and cell cannot repair the damage, then they set it chronic inflammation.
Mm.
So then together, free radical and inflammation, inflammation occurs, they also start releasing a lot of free radicals as well as pro-inflammatory cytokines. So these two together then start damaging all kind of cell in your body, including immune function. And your immune function is down, then you become very susceptible to getting a viral infection or
So
any.
we're talking about free radicals basically ripping us apart
Yeah,
at the cellular level. So
yes,
our actual cells starting to break apart,
yeah,
and that can lead to anything, being susceptible to any kind of virus, even the
yeah.
HIV.
Any kind of virus or bacteria.
And here we're talking about okay, this slide here just shows how your formula makes a difference. So you want to tell us a little bit then about, because you were just telling us a little bit
Yeah,
about the
yeah, our
intestinal
formulation.
dysbiosis.
Yeah, yeah. It is, for example, micro daily EMF is the only agent that reduces, because once you have a increased oxidative stress, you also have inflammation. You cannot have just increased oxidative stress, because increased oxidative stress, since it causes a damage to the cell and cell cannot repair it, therefore chronic inflammation is there. So both are together and feed each other, and inflammation have additional produce damaging molecules. So reduce oxidative stress micronutrient our is the only micronutrient preparation that can reduce both oxidative stress and inflammation at the same time. For
Mm-hmm.
example, if you take a Advil, it will reduce inflammation, but
But
nothing to.
not oxidative stress.
So this is the only agent that can do both, and this is very important for the immune function to increase the immune function. And of course, support once you are reduce it, then the mitochondrial function will improve, and DNA. I don't know, support
Mm-hmm.
DNA. DNA will be also protected because if you don't have if you have reduced oxidation, if you have increased oxidative stress, you will damage DNA, you will damage mitochondria, and you will open the door for HIV infection. So to reduce oxidative inflammation, you also protecting DNA, also protecting mitochondria, and it will improve the immune function. Therefore, it will also prevent the HIV infection.
So there's no contraindication then with your
No,
formulas with antiretroviral drugs.
no, no. Actually, it reduces their potential toxicity and improve the function. So the combination in a clinical study, first, if you give our product before, suppose you just started it, and there has been clinical studies showing that micronutrient, not our micronutrient, but micronutrient formulation,
Mm-hmm.
has delayed the requirement for antiviral therapy. And so there is a lot of a study with vitamin, but our product, I think, is sometimes people use individual agents. They forget that individual agents may not be as effective because they can be oxidized and become less effective. And vitamin, with respect to vitamin C and E, once they get oxidized, because these patients have a high oxidative stress, the effect will be not as significant. And so that's why multiple micronutrient is important. And so by giving a micronutrient, suppose if somebody gets HIV infection and just diagnosed, oh, you have HIV, then before giving the antiviral therapy,
Hmm.
but he started with micronutrient, like you saw in the graph, and they found they delayed the requirement by 2 or 3 years so that you don't get antiviral therapy because antiviral therapy also produce a lot of side effects.
Wow, Dr. Prasad, that's pretty amazing.
Yeah,
Delayed the need for antiretroviral drugs
yeah,
if
delayed,
they get
and then
micronutrients right
yeah,
away.
and in combination with that, they might reduce the toxicity. And as I said, like VitaminESuccinate is there, they will block reverse transcriptase and therefore cannot form a new virus.
That's staggering to contemplate, Dr. Prasad. So this is important for us to know. Now, what about any other virus? Does it have the same impact on
Yeah, that make
other
difference.
virus?
It doesn't make difference. No, the enzyme, for example, the say COVID-19 virus, that's a different virus. Their mechanism different. Mechanism there is that COVID-19 virus, they have a protein, and protein binds with the cell surface membrane and then enters into the cell, and then they start dividing it. And whatever they need, the cytoplasm is there, they start dividing. But this particular virus needs reverse transcriptase enzyme
Mm-hmm.
form become DNA.
I see.
And
Reverse.
DNA, once you form the DNA, then this virus is now DNA virus, not RNA virus. They incorporate in host genome and then start replicating it.
Wow. That's pretty impressive. One of the patents that your formula was the original formula was given had
Yeah,
to do with the immune system.
yeah,
And what you're just describing, then that's the basis for that patent.
yeah, no, yeah, because in human trial we did in Uruguay, Montevideo, and there, young people, 35 years of age, as you know, they are heavy smoker, and for 1 year study, and we provided the vitamin, and there were three criteria they were measuring it. And my colleague Zulema Kopas, she was a biochemist, and she knew measurement of all these things. They were measuring oxidative stress, inflammation marker, and also immune function. And so gradually in 1 year, the oxidative stress was going gradually down, inflammation was going gradually down. Not inflammation, I mean yeah, inflammation was going down, but immune function was gradually increasing up.
Oh,
So that's the first evidence, direct evidence, that it also not only reduce oxidative stress and inflammation, but also immune function.
whoa,
Human study.
wow.
Yeah,
Immune system was improving,
yeah.
and that was not the original target of the study.
No, but so I think it's so we have a pretty good human experience that it also not only decreases oxidative stress and inflammation, but also at the same time immune function, because these are the two major things that causes damage to the immune function. So if you reduce them, the immune system improves automatically.
It's gonna improve.
But to demonstrate it in a clinical study is different, and without any toxicity.
No toxicity whatsoever. Yes. Yeah, and I think that's the thing that's important. And I look back again, and I still recall that helpless feeling I had when this woman said to me that they were praying for my mom's immune system to kick in.
Yeah,
That I had no option, to offer. And of course, in the intensive care unit, it's not like the doctors would allow, me to just go in there and just, give my mom something
yeah.
uh, per
I mean,
se. But
I feel bad every day because my son, younger son, Mike, died of cancer. But at that time, I have no idea of high dose antioxidant. So
Wow.
I cannot use it.
That's right.
So
That's
I
right.
today I feel bad
Mm-hmm.
that I didn't have this knowledge.
Well, that's the reason why we keep doing the research,
Yeah.
and we don't stop. Keep
No.
ourselves open, and like you can't help but applaud the fact that right now we have 83 connections on this meeting. This is a Sunday in the afternoon, and the folks that are here could be doing anything else. I happen to like football and basketball, and there's a lot of that on Sundays.
Yeah.
But I break off the time because it's an opportunity to talk to you and learn something else. And these folks have done the same thing. So I'm personally applauding our audience here, Dr. Prasad,
Yeah, I really
because
do. I do too.
yeah, they're here.
Uh,
They didn't
It
have to
is
be here.
important to learn it so
Hmm.
that not only they have knowledge, but they can teach their friends, relatives. Here is the recent knowledge, and you can go and look my credentials. I've never made it up. It is based on
No,
research.
that's right. That's
I've
right. No,
been
we
made.
have I think anybody who's here that doubts your credentials and your background has not done their own due diligence and their homework. But we've done the homework and we know. So for those of you who have joined since the beginning of the discussion, Dr. Prasad really is more like Professor Prasad. So he was a professor at the University of Colorado School of Medicine for some 30 years. And that's the reason why we value his insight and his knowledge. I do want to hear from anybody who was immunocompromised in some way, because we with all these connections on this Zoom meeting right now, if you were someone who was immunocompromised in some way and you benefited from one of Dr. Prasad's formulas, would you mind raising your hand and tell us about it? There may not be anyone here for that, but there may be some other stories that someone would like to share about their situation and using some of your formulas and how it had a direct impact on them. Um, and when I say immunocompromised, I'm talking any level of immunocompromise. So that could be autoimmune dysfunction. In fact, Alfreda is on here now, and her condition was was an autoimmune disorder. But let's go ahead and hear from Ed and Joyce. Ed and Joyce, if you want to join us here on screen,
Hey,
turn your camera on, and we'll just add
yeah,
you to our
yeah, okay,
discussion.
good. Yeah, thank
But
you. Yeah,
you
thank
want
you,
to share
Dr.
a story
Prasad.
with
And
us?
yeah, thank you, Dr. Prasad, Jonathan. Very, very clear explanation of the problems with HIV and very interesting. Um, there's a lot of time we're at 14,000 feet, 14,500 altitude. And people that live up there, um, they have some trouble getting enough oxygen into their body from the US point of view, but they survive pretty well at 89% concentration. And anyway, I just wanted to mention about a friend of ours that we've known for many years, a woman, and she was climbing hills and visiting people at between 13 and 15,000 feet. And she was doing very well, except her health started to go down. When she started taking the micro daily, um, just the preventive dose, she and the probiotic. I mean, she just was totally different person. She was just so energetic. And the thing that I'm seeing is she was having all kinds of problems, right? So what we were seeing is exactly what Dr. Prasad said about what happens with the HIV virus and also other viruses and building up the immune system. It was very, very notable, as well as her husband uh, taking it, and he was also going down. He had a problem with his with a physical injury to his thyroid, and when he started taking it, he's still working on that, but it's like 75% reduced, and very, very interesting. One of his friends had a multitude of symptoms, and thinking about the immune system, like you were mentioning, a woman probably 60-ish, and she'd been to all the different places, and gone through the analysis, and she was just having all kinds of trouble with just existing. And when she went on the probiotic microdaily EMF and the omega, she was just so much better. And now, so those three seem to be typical. Also here, Dr. Prasad mentioned pre-existing cancer, and we've just worked with a family that the husband had cancer. He was really, really down, and he'd been on about 5 months, and like you say, kicking in the immune system, and he is just able to do things. Normally wasn't able to work, wasn't able to do pretty much anything, and now he's fully operational. Very, 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 very happy for us. It was really nice for us, Dr. Prasad, to see how well he's doing. And he had the let's see, was pancreatic cancer. So very, very nice. The immune system, boy, it really kicked in, and he's very happy. We're just really so thankful and he is so thankful to do okay.
The immune system is absolutely everything, and all the cases that you just mentioned there, Ed, reinforces everything that Dr. Prasad just told us about.
Yeah, and that's what I was thinking. They're different illnesses and conditions, but it worked in all of those cases in the sense of giving the body what it needed so the body could do its job.
Yeah, I think I'm glad that Ed, you did not recommend the collagen for cancer patient. Also, in case of HIV infection, also that I don't recommend, based on research I did, not recommend collagen peptides as a member of core 4, but 3 intestinal, the probiotics and omega-3, and of course microdaily EMF is a must for improving your immune function and also dealing with the HIV virus growth.
Yes, and he was two of those friends were staying away from, obviously, because we mentioned that about the collagen, and they all stayed away from the collagen. They're hoping they can get on it, but right now, no. And that really did help.
What happened, at least in 8 cases, what collagen does is excess of collagen deposited in lymphoid system and creates all kind of a problem for immune function. And so I said, after knowing that, I said, no. But intestinal dysbiosis is so severe. That's amazing that even the drug that they are using for the treatment, they are not using probiotics.
Wow.
Yeah. The person with AIDS, she was able to take the probiotic and the others, but she wasn't able yet. Her system couldn't handle the microdaily yet, but I think she's going to get better on that.
But in general, for most people, intestinal dysbiosis and under any disease condition, but in this case, the virus severely enhances the severity of intestinal dysbiosis.
Wow.
So anybody who is getting a treatment or have HIV infection, I would say, ask your doctor if you can take probiotics. It is a must. And so
yes, she did very well with that. Yes, thank you.
With omega-3.
Wow. I can tell you that omega-3 is the boss. Ed, thank you very much, Ed. Those are some very encouraging stories to hear, and I think our audience benefited really nicely from that.
Yeah.
Wow.
That's just the tip of the iceberg. We got a lot more, but thank you very much. Appreciate your time.
Well, it's awesome to see this all happening. Alfreda has a story to share because she was dealing with an autoimmune issue.
Yeah, very serious autoimmune issue. In February, of course, I finally got diagnosed with what was going on with me, and they did the anti-DNA double-stranded tests and diagnosed me with lupus. And going back 20, 25 years, they would always give me that test, but I would err on the side of Sjogren's syndrome. And so, now I was erring on the side of lupus. And my number at that point, and they tested me in February 20th of 2025, was 386, which is a very high number, meaning that you're very much into the disease. And they, continually, both doctors, the hematologist and the rheumatologist, said that based on my numbers, I should be very sick. I should be catching every disease that walks past me. And then I also should have had cancer. I did have enlarged lymph nodes, and so that's why they were suspecting cancer, and they did a biopsy. And it was just interesting because they kept preparing me for it to be cancer, and I'm like thinking like, I don't think so, because I'm taking micro daily. And interestingly, they both doctors commented to me that I had my micronutrients in my body was at a very good level. And so I said, well, that's because I take a patented micronutrient formula from Dr. Prasad, and the hematologist, he just said, oh, bah humbug, and blew it off. And the rheumatologist, when I told him, because he said exactly the same thing, he said, only way I can tell you have lupus is from your blood tests. And so I said, well, based on what you're telling me, I think, I said, I take a patented micronutrient formula that I believe is protecting me from all this stuff that you say I should have. And so his response was, well, what's in that stuff? And so that was the response that I wanted to hear. Somebody that was willing to listen to what I was doing and also support that. So he has continued to support me in that. He had me give him a picture of the ingredients of the product with Micro Daily, and he brought another doctor in, and they were both kind of looking at me like I was from Mars, scratching their head. And they was like, okay. And, they just insisted, well, you need to take, the stuff that we want to give you. And I said, but the stuff that you want to give me is going to make me sick. And they said, oh, because they tried to back off of that. No, it won't suppress your immune system and everything. And it really did. But the interesting thing is that I refused to take it for the first 3 months. So in October, I asked him, because I've been, doing my thing with Micro Daily. I talked to you, Dr. Prasad, and you gave me the thumbs up and just be consistent and hang in there. And you said it'll go away. So I did that. And so actually, I was only on their medication for 5 months because it was 8 months time. Because they just kept bugging me, and because I'm on intermittent disability with my job, I'm like, okay, I got to play the game. So I just would order the stuff and I wouldn't take it, and just so they couldn't say I was refusing to cooperate. And so, but I said in October 23rd, I went in there and I said, well, can you order that test again? I want to see where, what's happening. Is it changing or getting worse or better? And he said, oh, no, we don't need to do that again because you're going to have lupus for the rest of your life. I'm like, No, I'm not. And so first he was refusing to do the test, then he did it anyway. And when he did it, the first time, remember the number was 386. And when he did it in October, the number had dropped to 59.
Wow. Wow.
And I was like, I was calling Jonathan because it was a week before I would see him again. I'm like doing chat GPT, trying to verify, is that really in my chart? Is this really what's happening? And so when I met with him again, I was like, well, what about that number? Did you see that? I'm a 59. What does that mean? What's normal? He said 30 is normal. So I'm like, oh, wow, 30 is normal and I'm 59. I said, so what you say, doc? What you got to say about that? And so he was like, well, you are in remission. I was like, okay, yeah. So I finally got him to admit that I was in remission. And, he's like, keep doing what you're doing and everything. They did have me on prednisone for about 3 months. So I traded one for the other because that messed up my bone density. But I did find out, because this is who I am. I've learned to research everything they say to you, because then he wanted me to choose between three other dangerous medicines. One, Evenity.
Well, hang on. YouTube will shut us down if we get into too many details.
Oh, okay. But
So
anyway, I'm doing really good. And I'm not taking that medicine. I found out I can work on it naturally. And so the other good thing is that my sister was stage 3 breast cancer. And I just found out, she was struggling with taking the products, because she has Sjogren's syndrome. So she has a very dry mouth and dry eye. And so it was difficult. She couldn't take the pills without eating something, because it would just get stuck and everything in her throat. And then she delayed a lot in the beginning. And so she found out about her cancer in October, but she really didn't start doing anything till February, which is like, what are you doing? What are you doing? You're just letting it grow. What are you doing? So then even when she got on it, she's like, well, I don't like the way the powder tastes. And I'm like, and you ain't gonna like the way chemo tastes either. So so she finally, because she did have to uh, make a decision because of all these delays. Now it's at critical. You're at stage 3. So and she finally got buckled down and really started taking the product. She's doing 27 a day, or
therapeutic
of the
doses.
pills. Yeah, she's doing therapeutic doses. And they just told her Monday, December 1st, the doctor examined her. Now she had a lobular breast cancer, which is, I guess, maybe a little bit more challenging. And so it had consumed her entire right breast. And it was in her lymph nodes. So the doctor did a breast exam with her hands and told her that she couldn't feel the tumor anymore in her breast or in her lymph nodes. And then she went a step further and told her that for people with her cancer, the lobular cancer, she has never seen someone respond this well. Now, the doctor might think it's the chemo, but
Of
we know
course.
what it is.
Of course.
We know what the extra kick butt cancer killer
Well,
is.
Alfreda, this is powerful. Two
Thank you.
powerful stories. And
Yeah.
And just so that everybody can understand the context here, Dr. Prasad, Professor Prasad just gave us a complete earful as to exactly how the immune system works, and that it's so powerful that it can turn an immune dysfunction or a lack of functioning immune system into a powerhouse, powerful enough even to address things like cancer. So that was the reason for these two additional stories. So that's phenomenal. So Alfreda, thank you. Thank you
You're
for
welcome.
sharing those
Thank you,
stories.
Dr. Prasad. Yeah.
Yeah, I think our audience needs to hear this kind of thing. That's amazing, Dr. Prasad. Every time we hear these things, it's mind-boggling.
Yeah.
Absolutely mind-boggling. So we may have time for maybe one more brief one. Gretchen, are you wanting to share a brief story, or do you have a question for Dr. Prasad?
A brief story.
Okay.
I was talking to you both about my bone density test, and they told me that I had osteoporosis. So you told me to start doing the therapeutic dose, and that not the cancer therapeutic dose, just the regular therapeutic dose. And so I did that.
Triple doses twice a day?
Yes.
Mm-hmm.
And then I started doing additional vitamin D3 and calcium, because you told me that that was something that I could do. And it was probably about 4 to 6 weeks, and they did the bone density test, or scheduled the bone density test to happen again a month later. So in all, it was about 2.5 to 3 months. And they did it, and they told me that I don't have any signs of osteoporosis. And so I was like, yes. It was I have all my paperwork, because Deborah Bowman, the one who introduced to me micronutrients, I let her see all my numbers, and she said, this is great, because my white blood cells was through the roof and my red blood cells were down. Everything was just out of whack. And of course, all of this was coming from the fact that I had cancer. But of course, I am cancer-free. All my numbers are normal, and I do not have osteoporosis.
So
Thank you, Dr. Prasad.
Gretchen, that's a powerful story. Thank you. So Dr. Prasad, she took triple doses of your formula, micro daily.
Twice a day or once 3 times?
Twice a day. Okay.
So
Twice a day.
So 6 in the morning, 6 in the evening.
Yes. And or even if it was the original, but just triple doses twice a day. Correct. And your probiotic, but she also went on D3 and calcium, because those are okay. The doctor wanted to do that. But she went from being diagnosed with osteoporosis to now not having a diagnosis of osteoporosis.
That's amazing.
All right.
Yes, so, my doctor told me, he said, whatever I was doing, to keep doing it.
I bet he did. I bet he did say that. That's a beautiful thing. Mm-hmm. So listen, folks, just so that that everyone has an idea here, we already mentioned to you that nothing here is being recommended as a treatment or cure for any disease. So testimonies are purely anecdotal. What happens to one person may or may not happen to you. So if you want to know more about Dr. Prasad's formulas, if you want to know more about the company that has taken his formulas to the market, just get back with the person who invited you to this presentation. And you can take charge of your immune system. You can do something about your immune system and be completely in control. And one important thing that we highly recommend, and Dr. Prasad is in full agreement with this, is we recommend that you do for yourself. Don't ask a pill, potion, or lotion to do for you what you could do for yourself. Get yourself moving. change your relationship with your couch. Change your relationship with your couch. Get moving. 7,000 steps a day. Don't let your mind get buried with 10,000 steps a day as a requirement. If you can do 10,000, fine, but just try to work yourself up to at least 7,000 steps a day, and get moving. Change your diet. You'll be amazed at how much better you will feel and how your body will thank you, for the effort that you put forth in giving yourself a fighting chance, an opportunity to heal and to heal properly. So, Dr. Prasad, once again, sir, we can't thank you enough for everything that you do for us and all the information, the insights that you give us into how we can feel better. And our audience is better and happier, and their bodies are functioning so much better as a result of the recommendations you give. So we thank you very much for that. So, folks, if you all want to unmute yourselves and say goodbye to Dr. Prasad, feel free to do so. My team 615.
Thank you.
Thank you.